Hi everyone, we're going to go ahead and get started. Thank you guys so much for joining the webinar today on Tennessee's revised Medicaid block grant proposal. We're really grateful to everyone who's joined this call and webinar. So we have some slides up. If you're just joining on the phone, we're going to send out the talking points and all the materials afterwards as well, so no worries if you're just joining us via phone. If you are on the computer and you have questions at any point during the webinar, please just submit them through the question box on the screen, and we'll be able to answer those questions. If you are just joining on the phone, feel free, I'll send an email afterwards, and if you have any questions that we didn't address, feel free just to let me know, and we'll try and get an answer back to you as soon as we can. So I don't think I introduced myself, but I'm Keila. I'm the Director of Medicaid Policy Advocacy here at the Tennessee Justice Center. And I'm joined with Gordon Bodyman, a staff attorney here at TJC. And we're talking today about the revised Medicaid block grant proposal that Tennessee submitted to the federal government in the middle of last week. So a little bit more about what we're going to talk about today. We'll give a little bit of background and context about the proposal, how we got to this point, and then we're going to explain the proposal and some of the revisions that were made before it was submitted to the federal government. And finally, we'll end with how you can oppose this harmful proposal and some action items and next steps. We'll leave some space at the end for Q&A, but again, feel free to reach out when I send a follow-up email if you have other unanswered questions that we didn't get to. So with that, I'll just turn it over to Gordon.
Okay, thank you, Keila. Let me just take a couple of minutes. Probably most of the people on the call already have this information, so I'll be brief. But just so everybody understands, the Medicaid program, which we know as TennCare, dates back more than half a century. It's a federal-state partnership created by Congress in the 1960s, and it provides health care services for a vulnerable population that actually represents now 1.4 million Tennesseans. It's partially funded by the state, partially funded by the federal government. There is a structure that's created by the law, by the Medicaid Act at the federal level, and then states have a great deal of discretion about choosing from a menu of policy options, who they cover, what services they provide, how much services those services they provide, how much they pay the providers, whether they use managed care or fee-for-service. Those are all options that are available to the state. Our state operates TennCare under what's known as a waiver, which allows it to waive or suspend certain rules that at the federal level the state would otherwise have to comply with. So the basic structure is there is a architecture that's created by the federal law. Within that, the state must comply in broad terms with any number of different federal regulations. Those regulations cover the gamut from patient safety and health to who is paid and how they are paid to provide services, to who is eligible, and basic fairness in terms of treating people equally and ensuring that they have a right to appeal if there are problems that arise or mistakes that are made. So fairly complicated, but the state has a lot of discretion, and the basic rule is that for every dollar that the state spends on services, the federal government puts up nearly $2. It's a 65% or nearly two-thirds federal match. And it's open-ended. It's called an entitlement because anyone who meets the eligibility rules that are established by federal law and implemented by the state is entitled to receive the covered medical services that the program pays for, as those are medically necessary. And that's distinct from a block grant. A block grant, Congress appropriates a fixed amount of money for a particular purpose, and if those are in the form of grants to the states, the state gets a certain amount of money, and when that money is gone, then there's no more unless the state picks it up at that point and pays for it, which typically is not the case in Tennessee. And you have to wait until the next congressional appropriation to start providing those services again. So an example would be our TANF program, which is Temporary Assistance for Needy Families. It's been a lot in the news recently. The program here is called Families First. It's for cash assistance for extremely poor families with children. It's primarily for the benefit of children living in poverty or deep poverty. And that's a block grant. It was an entitlement until about 23 years ago, and it was turned into a block grant. And the state gets a set amount of money from the federal government each year and a great deal of discretion. And what's been in the news recently and in the headlines is revelations that we've accrued $732 million in that program unspent, while the very poorest children in the state and their families have struggled with incomes that are, in many cases, only a fourth of the federal poverty level. And so there's a great deal of concern about that, and everybody is at this point wondering, how could the state so have misused the discretion it was given in that block grant? And I think that cuts across the political spectrum. Republicans, Democrats, everybody's sort of scratching their heads and saying the state has not been a good steward of that. Once stringent federal standards were eliminated or relaxed under the previous cash assistance program for poor children, the state has in recent years done a poor job of administering the program. So the current structure of TennCare and of Medicaid is that it is still an entitlement program. The state is still bound to meet a whole host of federal requirements, and in return for that, it's assured that every dollar it spends will get matched by nearly $2 of federal money, and that's very important in health care because, as probably everybody is aware, for over 60 years now, health costs in the United States have risen more rapidly than the rate of growth of the economy as a whole or state revenues. And so the ability to draw on federal matching funds has been critical to the state's ability to sustain the program. As I mentioned, TennCare covers 1.4 million people, but it's not just any 1.4. It's the most vulnerable population in the state. It consists of half of Tennessee's children rely on this program for their health care. 60% of the people who are in nursing homes, 2/3 of the people who are getting home and community-based services who are elderly, and a much higher percentage, almost all of the people with intellectual and developmental disabilities who are receiving institutional care or home and community-based services in the community are beneficiaries of the Medicaid program. Medicaid is the principal source of coverage for families living in rural areas in the state. As probably most people on this call are aware, we have a rural health crisis in Tennessee. The rate of hospital closings in rural Tennessee outstrips that of any other state in the country, and Medicaid funding is critical to sustaining the rural health care infrastructure. And Medicaid, in its current form, plays a huge role in the entire state budget. 20 cents, over 20 cents of every dollar appropriated in the state budget is federal matching dollars received through the Medicaid program. And those dollars don't just fund the kinds of services and people that I've just been describing, but they help sustain the operation of 5 or 6 different important state agencies: the Department of Children's Services, the Department of Human Services, the Department of Mental Health and Substance Abuse Services, the Department of Intellectual and Developmental Disabilities, and departments of health across the state. So it's very important, and keeping that funding secure is vital, really not just to the agencies that I've mentioned, but because it's such a large part of the budget, it indirectly makes it possible for the state to put more of its own money into things like K through 12 education or higher ed. So how do we get to where we are now? In the recent legislative session that concluded this past spring, the legislature passed a bill requiring Governor Lee to submit a waiver request to what's known as the Centers for Medicare and Medicaid Services. The abbreviation is CMS. It's the federal agency that oversees Medicaid. And the legislation required Governor Lee to submit a request to CMS to convert TennCare, our Medicaid program, from its current entitlement nature into a block grant. The bill itself did not have very many details in it, and it was really accorded a huge amount of discretion to the Lee administration to develop the proposal. That proposal came out in September, and it was required by federal regulation. The process is, if you are seeking a waiver, that is a request to CMS to be exempted from some of the federal laws that apply to Medicaid programs, then you have to post it for 30 days public comment, you have to hold hearings, and then you have to consider all those before submitting it to the federal government, which opens, and we'll talk much more about this, but then after there's been the state comment period, there's another 30-day comment period at the federal level. When the state submitted the block grant proposal for public comment, it elicited enormous pushback. There were only 10 public comments out of over 1,650 that supported the proposal. Importantly, one of those was from Blue Cross Blue Shield, which is a major TennCare contractor, and for reasons will become evident in a moment, they liked a lot of the proposal, which would do away with the federal regulations that regulate managed care and managed care contractors such as Blue Cross. But interestingly, and again not surprisingly, although they were rated as one of the 10 comments, they did object to a provision that would have allowed the state to cut the amount of money it pays to Blue Cross Blue Shield and the other managed care contractors. So there are very few that were just, even of the 10, that were unequivocally in favor of this proposal. And when we talk more about it, you'll understand why most people who are informed about it were quite concerned. There were 5 public hearings across the state, and the turnout for those hearings was great. And I'm sure many of the people on this call get credit for both going to hearings and submitting comments and encouraging others to do so, for which we're very grateful. Only one person who had a commercial interest in the block grant spoke at the hearings in favor of the proposal. We will, in the slides that we send out, we'll connect you to a link of our analysis of the state comments. So where are we now? Well, the legislature required that the waiver, regardless of public comments, proposal be submitted to CMS by November 20th, and on that deadline, last Wednesday, the TennCare division did submit a waiver proposal to CMS as required by the statute. And now it's being reviewed by CMS, and possibly as soon as the beginning of next week, it could even happen tomorrow, before the holidays, it will be posted at the federal level, and a new 30-day comment period will begin. And Keila will talk more about this, but it is critically important that individuals and organizations submit comments that unequivocally oppose the block grant waiver. And it's important to do that even if you or your organization submitted comments during the state comment period, because those earlier comments are not considered by CMS or by courts that will probably ultimately review this waiver if it is approved. And those comments are very, very important when we get to the question of judicial review or court review. So let me talk a little bit about what's in the block grant and how it differs from what was submitted before. As I mentioned, there was overwhelming public pushback, and thanks to those of you on this call who participated in that, and it's really a testament to the power of a mobilized public expressing concern, because when the legislature passed this bill, they thought that they were doing something that would be politically popular. That's why they did it. And in fact, people have taken the time to learn about it and understand that it needs to be opposed. And the state we did not expect, based on prior experience, the state to make any significant changes in response to public comments, but they did. And again, kudos to those of you who helped make that happen. They had requested permission to be able to cut the benefits package, that is, how much time you get to have covered in the hospital, or how many doctor's visits, or how many prescription drugs you get, whatever, that they could cut those benefits without getting federal permission and without meeting federal standards. And that was a main point of objections at the hearings and in the written comments, and they deleted that request. They also clarified that the early and periodic screening, diagnosis, and treatment, or EPSDT is the abbreviation, services for children would not change. And that's important because those provisions in the federal law mean that children, regardless of what other limits may be imposed on adults, that children are entitled to receive whatever medical care is necessary for them. And they agreed that the limits they were proposing would not apply to children. That's the good news, but the bad news is that in practical terms, the most damaging features of the original proposal still remain. So we can feel good about having won those two concessions, but in fact, we've still got an enormous amount of work to do. So, and we're going to share all this in documents that we'll send out to you afterwards, but just want to cover 5 main takeaways or things to know about this block grant proposal. First, it invites for discrimination against patients with costly medical conditions. 1 in 3 Tennesseans has a pre-existing medical condition, and in the Medicaid population, because it's targeted at adults with disabilities, children with disabilities, frail seniors needing nursing home care, people with intellectual and developmental disabilities, the level of chronic disease and costly medical conditions in the Medicaid population is very, very significant. And because Medicaid was designed at the federal level to serve those populations, it has a provision in it that says states may not discriminate within the Medicaid population. They can't give more services to one group than another. They can't discriminate against patients on the basis of their diagnosis or their condition or the level of their need for medical services. And that's one of the provisions that the state wants to do away with, to no longer have to comply with. It says it wants to do that so that it can, quote, target benefits to certain populations. Well, that's very concerning. I'm sure that the intention is to be able to do that in a benign or positive way, but we know that when a recession comes and the state is under financial pressure to cut Medicaid, it goes where the money is, which is where the most costly services are provided, and that's in the patient population that has the most needs. This proposal would also eliminate a provision that requires so-called parity or equality of treatment between patients with mental and addiction problems and people with medical conditions. And if you provide a service that is adequate to meet someone's behavioral health needs, then those services have to be comparable to what they would get if they were suffering from a physical or medical condition. And as those of you who are familiar with the whole effort to combat mental illness and addiction, advocates have invested decades in winning parity protections, and those would be done away with in this waiver. And then finally, another major feature is to only be required to cover one prescription drug in each drug class. And we know that that will have a disparate impact because the state is doing that to save money, and so you look at very high-cost conditions to treat, such as cancer and hepatitis, and if the state is only required to cover one drug, it's certainly not going to cover the most expensive. In some cases, and a good example of this is hepatitis, the drugs that by far are the most effective and can actually achieve a cure are quite costly. And I think there's reason to believe that the state wants to relax those requirements so that it can discriminate, if it chooses to, if it feels it needs to for budgetary reasons, against patients with costly medical conditions. Again, it says it has no intention of doing that now, but it's asking for the power to do that, and inevitably, when the financial pressure is there, I think we can expect that to happen. Second, although the most costly and sickest patients are most at risk, this block grant proposal really doesn't spare anyone. It puts all TennCare patients at risk, and the reason for that is that TennCare is unique in the country in that all patients and all services covered by the program are now administered through Medicaid Managed Care Organizations, also known as MCOs, and popularly often known as HMOs. Those are all the same things, and these are insurance companies that contract with a network of providers, such as hospitals, pharmacies, doctors, and labs, to meet the medical needs of their members. The people who sign up for TennCare are assigned to them. They receive a fixed payment known as a capitation payment at the beginning of each month. The insurance companies do, MCOs, and they are then responsible for providing the services that the patients need within that money, within the amount of money that they receive. So if they run the program efficiently and they are able to spend less than the capitation rate, the difference goes to them as profit. If, on the other hand, services cost more than the total amount that they receive in those capitation payments or insurance premiums, then they lose money. That creates a powerful incentive to control costs. And managed care can have some positive features, but it can also have some features that create incentives for financial abuse and for denying care. And in fact, Tennessee is no stranger to those abuses. 20 years ago, when TennCare was relatively young, we were in the national news for scandals that involved TennCare MCOs being insolvent, going bankrupt. The taxpayers ended up on the hook. Healthcare providers went unpaid, and because healthcare providers weren't getting paid, they wouldn't treat the patients of the patients that were assigned to those insolvent MCOs, and so hundreds of thousands of TennCare enrollees had TennCare cards that said that they were assigned to Access Med Plus or the Phoenix Health Plan, and there were no doctors that would take that card. They couldn't get care no matter how urgent their need. In effect, they were uninsured. And so the federal government, in response to those scandals and similar abuses that occurred in other states, most notably California, passed a whole set of rules that said the state must pay actuarially sound rates to the MCOs with which it contracts. In other words, these are insurance payments, and in the insurance industry, actuaries are experts that analyze what the reasonable cost of services for meeting the needs of a given population should be, and they set the rates based on what can be anticipated to be adequate payments for the benefits that are being provided. So a cardinal rule is that the states have to pay actuarially sound rates. The MCOs, in turn, have to meet solvency and financial soundness requirements. They have to have adequate networks of providers and so forth to actually meet the needs of their patients, and that's not just the adequate number of doctors, but doctors with the right specialties to meet the full range of patient needs. And then they have to pay the patients promptly. They have to ensure mental health parity that I mentioned a moment ago, that there's equality of treatment between mental health and medical ailments and patients with those ailments. And then there are other procedural protections when managed care companies deny service. So those are all very important, and they were put in place for an important reason. And the state, with almost no explanation in the block grant proposal, says it wants permission to operate a managed care Medicaid program that does not comply with any of those standards. It's really sort of mind-boggling that a state with our history would ask for that, and really with no justification other than that the state says we do a fine job on our own of regulating the MCOs and we don't need this additional level of federal protection. Well, the record is quite different from that, and although there's adequate regulation now, that's with an overlay of these federal rules. If those are gone, it's easy to imagine, again, particularly in a situation where we have a recession and the state is facing budget pressures, where it cuts the capitation rates to the providers. That scares away the legitimate MCOs that operate sound programs, and what you get are bottom feeders who are willing to take those inadequate rates because they don't have any reservations about taking the money and then operating an inadequate provider network and simply not providing the services. We've seen that play before. We don't need to watch it again. And again, this is not to impute bad motives to current TennCare officials or the Governor Lee administration, but the reality is, if you know anything about the history of this and other Medicaid managed care programs, you know that you are setting yourself up inevitably, not just probably, but given the economic cycle and future pressures on the budget, you are setting yourself up for future scandals and abuses. And the reason why we say it affects, the block grant waiver affects all enrollees, is that when you do away with the managed care rules, that affects all the services and all of the enrollees. So, for example, statements that children will not be affected by cuts in benefits, well, they may not be affected by cuts in benefits, but if they can't get to a pediatrician because pediatricians have all been scared away from participating in the program because it has such a bad reputation because the managed care rules have been done away with, then those children are not going to be able to get care, something that's been demonstrated by experience. Doing away with those rules for managed care also has implications for taxpayers because, as I mentioned before the current federal managed care regulations were in effect, taxpayers ended up paying for services twice because they paid the managed care companies. The managed care companies didn't deliver the services. They went bankrupt. Providers were left holding the bag, and in many cases, taxpayers had to step in. So we're talking about a $12 billion program. It's the largest single program in the state budget. Anytime you have that much public money floating around, it is regarded by federal regulators and law enforcement as a program with a high risk of financial abuse. That's not because the people who are in the program, it's just if you put out honey, you're going to attract flies. If you have a large program like this, it needs rigorous program integrity safeguards, and those are among the rules that would be waived under this block grant. And it's not just ancient history that concerns us. TennCare and I'm not here talking about abuse or anything criminal or unethical, but just in terms of meeting basic management standards, TennCare is a trouble program. It currently has a computer program that's been online for about 6 months called TEDS, the TennCare Eligibility Determination System. Tennessee, like all the other states, was required to have that new system in place to determine eligibility for Medicaid 5 years ago. It only came online 6 months ago. We were the very last state in the country to come into compliance. It was what was supposed to be $37 million. We spent $400 million, more than 400. So we were over $400 million in overruns and 4.5 years late, and the program still has significant problems. You've probably seen headlines within the past few months that TennCare cut off over 200,000 children, most of whom were still eligible, and can't explain why these children all lost their coverage. So this is not a program that needs less accountability, it needs more. The legislature basically told TennCare, we're giving you a blank slate, go ask CMS for a block grant, you get to write it, and human nature being what it is, not surprisingly, the people who wrote the block grant said, well, if you're asking us what we'd like less accountability. We'd like to not have to account to the federal government. We'd like to not have to meet many of these federal standards, and that's understandable. Not impugning anybody's motives, it's human nature, but it's not good policy. I mentioned a moment ago that one of the features of the block grant is that by removing the managed care rules and by allowing the state to only cover narrow, by current comparison, narrow prescription benefits, it gives the state enormous flexibility to cut the program. And what makes that particularly worrisome is that it also creates powerful incentives to use that power to cut TennCare benefits in ways that we have seen before when economic hard times arrived in the state. And it can do that by simply reducing the capitation rates of the HMOs and then leaving it to the HMOs to make the adjustments to make all that work or not for the patients and the providers. And that makes it very easy for the state to take as much money out of the program as it wants to with really no checks and balances on that. It can dial back which pharmacy product it covers, whether or not it's the most effective one. So it's got that power, and what gives it a huge incentive is that it can then, from any savings, under the proposal, half those savings would go to the federal government, the state would keep the other half, and it can use that money. Initially it said it would use that money in the TennCare program. In the revised waiver it says it can use it for any expenditure that could affect the health of TennCare members. Well, that's a very broad word. It's no longer restricted to the TennCare program. Law enforcement, police protection, guarding prisoners in our state prisons, subsidizing the charter schools, if you happen to think that and interpret charter schools as something that improves the health of children. We know, for example, that education does, in fact, affect people's health. So it's a very broad definition, and it creates an opening. Right now, under the current federal structure, the state can only draw down federal match and use it for the prescribed health care services. Now, under the waiver, if it's granted, it would be able to use those for other parts of the state budget, creating a powerful incentive to exercise the power to cut the program. Those of you who go and look at the waiver, it's online, and we'll send you the link. A number of people have looked at it and have been intrigued by something which is a list of priorities for program innovation, which appears on page 24. And it's actually a very significant list of health problems, and it's a legitimate list. It identifies, there are 5 different things that the state sees as priorities. One of those would be to extend coverage for pregnant women after they give birth for up to a year. You may be aware that Tennessee has a problem with rising rates of maternal deaths, and there was an article recently in which the state acknowledged that 51 of the deaths that occurred of new mothers within the past year were preventable. Many of them related to women who had addictions. They had gotten clean for the sake of their children, and then after the children were born and they were dealing with the stresses of motherhood, with a new infant, in some cases postpartum depression, they went back to medicating themselves, and most of those deaths were sadly due to overdoses. And the thought of an infant being orphaned and so young, and the hopefulness and happiness of a new life and a new family, it's really heartbreaking to think about. And the data which the state cited was that we can prevent those deaths by extending coverage to a full year. Right now, many of those mothers are only covered for 60 days postpartum. Very legitimate priority. Another was to provide dental care to pregnant women, because there's a lot of scientific literature linking health outcomes for infants and moms to oral health and the risk to the child of dental infections and to the mom. Covering additional needy individuals, we know that there are hundreds of thousands of Tennesseans who are uninsured, and it talks about possibly covering them. Clearing the wait list for individuals with intellectual and developmental disabilities. There are over 5,000 people with serious intellectual or developmental disabilities that need services, can't get them because of the wait list. This has been a huge issue for decades, and it remains a problem. And addressing other specific health crises is also mentioned on this list in the waiver, such as the ongoing crisis with the addiction epidemic and overdoses, et cetera. These are all listed as priorities, and what the state says about it is that the state might undertake, and I'm reading in the language, might undertake under the auspices of the waiver to address some of these priorities. But it would have to get the waiver, and it would have to realize savings by the methods I've just identified in order to do that. It's no commitment to any of that. And a number of people, including the media, have read that and said, oh, well, if they get the waiver, they're going to do this. They are very careful to say, no, we're just dangling this out there as an enticement to people to get behind this waiver. And frankly, we think that that is cynical. And the reason why we think that is because the state could do those things, many of those things right now. For example, postpartum coverage for pregnant women, they could check a box this afternoon on the state plan, Medicaid plan, and implement that. They could, in fact, expand coverage to 300,000 people following the model that was set out by former Governor Haslam in his Insure Tennessee plan. They could bring in literally hundreds of millions of dollars by that device to fight the addiction crisis, but they haven't. The reason why they haven't is the legislature has blocked the expansion. The same legislature is now saying, we want this block grant instead. So I think it's important to realize that the program priorities that they talk about, program innovation priorities, are really a marketing ploy. They're not a commitment, and they should not in any way distract us from the task of opposing the damaging elements of this block grant and its effects. And the final point to understand about this is that this is a political gimmick. The legislature, having barred the expansion of Medicaid, and now we see that 37 states, including the District of Columbia, The great majority of states have now expanded Medicaid, and nearly half of those are run by Republican governors and legislatures. So our legislature, in a partisan way, backed into opposing Medicaid expansion because it was seen as Obamacare, and it was a partisan article of faith that you should oppose it. And the rest of the country is leaving us behind. And it's been very difficult for the legislature to get itself out of that political corner. I think most lawmakers understand that we need to expand Medicaid. We're leaving $1.4 billion on the table each year that passes. We're leaving 300,000 people without coverage. We're leaving rural hospitals at risk of closing. We're leaving hundreds of people with addictions who want to get clean but can't because they don't have insurance. All those things are out there that would be addressed by expansion. Or if they don't want to do a straightforward expansion, they can do something like Governor Haslam proposed and that other Republican governors done, which is to use the money but to use it with some additional elements that state officials would be more comfortable with than just a pure Medicaid expansion. That's fine. They're not doing any of that, and it's no accident that this originated in the legislature. This block grant is not the product of some set of health policy experts or clinicians. No, this is a political gambit, and it's to try to address a problem, but a political problem. It doesn't address our state's real health concerns. And if you think that we're just being crybabies about this or not being good sports, then you can look at this list that we will circulate, and for those of you who are on the webinar can see right now, it's everybody from the Cancer Society to the Heart Association. It includes AARP, United Ways. All of these credible organizations say block grants are damaging to patients, to the constituents they serve, and they oppose them. So now the spotlight will be on Tennessee. We're the only state to have ever sought a block grant. We are seeking one now. It could set a terrible precedent for the country as well as for our own state. This Washington Post article or editorial nailed it pretty well. This would sabotage our healthcare system. And as this pie chart shows, only 10 out of over 1,600 of the commenters who commented on this in the state period supported it. So you're in good company, and now we need to deal with this at the federal level, which is going to count so much. Take it away, Keila.
Great. So as Gordon mentioned earlier, where we are in this process is we're anticipating the federal comment period starting shortly, and we want everyone to be ready to submit their comments opposing this harmful proposal during the federal comment period. As we know, comments are the best way to defeat this harmful policy because the federal government is required to consider all of those comments, and if it doesn't, then the proposal can be overturned, which we did see with another harmful Medicaid proposal in Kentucky when that was stopped in its tracks. So we know that submitting these comments during the federal comment period, creating that administrative record is the best chance of defeating this harmful policy in the end. So even if you, as Gordon mentioned this before, but I just want to hammer it home, even if you submitted a comment during the earlier state comment period and you're thinking, why do I have to do it again? Please, please, please resubmit the comment with some of these updated talking points, this updated information about the new proposal, because it's really important that all of these things get into the federal record so that if it was submitted during the state period, it's not going to be in that federal record. It has to be submitted during the federal comment period in order to make it into the record that can be used then to overturn it.
And let me just add that if you go online, you'll see that the state did submit some of the comments, but those are not part of the record that will be reviewed by the federal government. So it's just, and by the federal courts specifically. The Kentucky case that Keila mentioned was overturned not because the judge thought that the work requirements that were proposed by Kentucky were illegal. He didn't even consider that. He may ultimately have to, but he overturned it just because there were so many comments submitted in opposition, and it was clear that CMS failed to give adequate consideration to those. So that's why this is not just an abstraction. This is very important.
Great. And so if you're wondering what to say in your comments, we'll send out some guidance, and as I'll mention soon, a really easy way for you to submit comments as an individual, and we'll also be sending out guidance for organizations in submitting comments that include some of these guidelines. But as a general whole, please unequivocally oppose the proposal in saying that it is harmful and cannot be fixed when you submit your comments, rather than suggesting just minor tweaks or changes or small things that could be addressed. The proposal on its face is very harmful in all the ways that we mentioned, and so please unequivocally oppose it in your comments. If possible, cite research and studies, and we'll be sending out some of those periodically throughout the comment period. And if you're interested in seeing some of those studies, reach out to us. We would love to have those cited within your comments. And if you are on TennCare yourself, or you know people on TennCare, or you're an organization that works with people on TennCare, it's really vital to share those stories of the negative impact that this could have for people on TennCare, including people who've had to go through so many bureaucratic hurdles just to get the care that they vitally need. People who are having trouble already right now with network adequacy of getting specialized services that they need, or getting enough nursing hours, the networks just being inadequate as they currently are. As Gordon mentioned, there's risks in the proposal for relating to network adequacy and making that worse with going back to the times without managed care regulations. Or people having trouble getting prescriptions they need right now. As again, this is one of the provisions in the proposal that could get worse for TennCare enrollees. So citing those stories is really important in the comments. And
I might add, there have been huge problems over the past 2 years, 3 years now, of people losing their coverage out of the blue or being put through all sorts of changes in order to try to regain their eligibility. That's not directly implicated by the waiver, but I think it's important to make a record that this is a program, this is an agency that has a difficult time just doing the basics, and it should not be given carte blanche to go off on a frolic of its own that it may not be able to execute properly. So as I mentioned, coming soon, we'll be sending out a quick, easy-to-use, maybe 3-minute survey that you can fill out to submit your comment during the federal comment period. So we're developing right now, and it'll be interactive and create a unique comment by answering some multiple choice questions and drop-down menu. It's an exciting new technology that can allow people to really easily submit a unique comment with their own voice and their own stories and message and thoughts. So when we send that out, please, please, please send it to everyone in your network. It's a really easy way to get people to submit a comment. It's not just, I know submitting a comment seems intimidating to a lot of people. What would they say? A comment, people are skeptical of what the impact will be and how to do it in an effective way. But we'll make it really easy for individuals to submit a comment through these guiding questions and very specific survey. In the meantime, the federal comment period will be starting soon, but we do have a form where you can pledge to take action, not only to make sure that you get the survey when it's developed, but also to commit to taking other actions if you want to do more. So, and if you do want to do more, I just want to highlight a couple upcoming opportunities where you can get involved. If you want to engage your community, your neighborhood, your school, your retirement community, your faith community, by getting people to submit comments, we're going to have a call just specifically about that, where we learn from advocates in the TJC community who have done this work to organize their communities. You can learn tips and tricks, share your ideas, and get more engaged with organizing other folks to combat this harmful proposal. So please join that call on Thursday, December 5th at 6 p.m. Central Time. And no experience is necessary. If you've never done anything like this before and you just want to learn more and see if it's for you,
Please, join us. We're happy to have you, and we're happy to talk more about how you can get involved in your own unique way. So when I send out the follow-up email, I'll include a link to register for that December 5th call, but we hope you will all join us on that. And the last thing I wanted to mention is anticipating the federal comment period will start shortly. We're going to need all the help we can get and the community coming together to combat this really harmful proposal. So we just put 3 dates for volunteers on the books for December. There's a couple in the middle of the day and one in the evening. So that's Tuesday, December 10th at 1 p.m., Thursday, December 12th at 5:30 p.m., and Wednesday, December 18th at 1 p.m. And again, I'm going to send all of this out. But you can, on those times, come to TJC's office to volunteer. We'll have tasks we can do, maybe some eggnog and Christmas music, or if you're not in Nashville, you can volunteer remotely. So we will
Virtual eggnog.
Virtual eggnog. What could be better? But if you want to volunteer, please let us know. Charlotte in our office is going to be coordinating volunteers. She's lovely if you haven't talked to her yet. Her email, for those on the computer, can see it here, but I'll send it out afterwards as well. But it is cpate@tnjustice.org. So we would love to have you participate in the movement with us and speak out against this harmful proposal. So with that, we'll take questions. If you have...
Can I just say something real quickly before we switch to questions and answers? We are extraordinarily excited by the response that people gave during the state comment period, both at the hearings and in the written comments. It is clearly put Governor Lee's administration on the defensive, put them back on their heels. I think they were not expecting that at all. We know the legislature was not expecting it at all. And when we ask for comments at the federal level, there's another audience for those as well, and that's our state legislators and Governor Lee. They are watching the political fallout from this, and as I said, this started with a bill in the legislature that was a political gimmick. They need to be persuaded that this was bad for them politically. And the best way to do that is to continue this firestorm of opposition during the comment period. And that is all just not defeat this idea, but to keep the pressure on them, get real, do something meaningful, expand Medicaid, and address our real needs. So this is all part of what is a positive opportunity. We need to make the most of it. The other is to just talk to you about why we are so anxious for volunteer help and enlisting community groups. This could not come at a worse time for generating comments. If they could start it the day after Thanksgiving, and it could end on the day after or the day before New Year's, 30 days. And just think about trying to engage people during that period. It's very daunting. So we're very concerned about that, and just want you to understand why we think this is a particular challenge.
Great. So if you have any questions and you're on a computer, just submit them in the question and answer box on your computer and we'll address them. And if you're not on a computer and you're on the phone, feel free to, again, email me and we'll try and get back to you as soon as possible with answers to your questions. So the first question is there any exit mechanism to the waiver if it's granted and then does not perform well?
The current waiver that we have, which has been in place for 20-something years, does have a termination provision. I think it's like 6 months notice, something like that. Presumably, this waiver for the block grant would have the same mechanism. The problem is that it would involve notice and some period, probably at least 6 months. And this program is so huge, again, it's $12 billion. If the money doesn't work, even at a relatively small percentage level, remember, integral to all this will be capping the amount of federal money as opposed to it being open-ended on a 2-for-1 basis the way it is now. We could get into very deep trouble in just 6 months once it's clear we need to get out. So yes, there will be an exit mechanism almost certainly, but no, it will not be enough to eliminate the danger.
Yeah, great. The next question is, legally, Governor Lee had to ask for this waiver, but do we have to accept it?
No, and that's another reason for the comments. Governor Lee has said if it's a bad deal that we negotiate, and it's important to understand there will be closed-door negotiations beginning now. And one of the things that frightens us is that they may not agree on the current terms, but they could come up with something else that's very damaging. And so Governor Lee has said in a very bland and vague way, well, if it's not a good deal, I won't accept it. That's one of the reasons why he needs to hear and see from the response that people really do not want this to go forward. He does not have to go through with it.
Great. We had another question about the parity requirements being eliminated, and is that due to the proposal stating that all MCO regulations would be eliminated? That's
correct. The MCO regulations have embedded in them our parity requirements.
Great. Another question is around out-of-state residents, Arkansas residents. Should they also be providing public comments on Tennessee's request for this block grant?
Oh, we want and encourage comments from all over the country because, again, this will create a national precedent. During a comment period a year ago on our work requirements, that's a waiver request that the state still has pending before CMS. We encouraged and received probably thousands of out-of-state comments because, again, once one of these waivers is granted, it has implications for other states. So, yes, please.
Great. Then we had another question about how this would affect access to drugs and about the closed formulary tying into drugs being excluded from the block grant.
Well, drugs are categorized, and I'm not an expert in this, but drugs are categorized into classes that relate to the illnesses or conditions that they are supposed to treat. And what is being proposed is that, let's say if you have a class, and this is hypothetical, but if you have a class of drugs for treating cancer, you might now have any number of drugs within that class, scores of them, dozens, that have been approved by the Food and Drug Administration and that are currently covered. And what this proposal says is we would have, and that's required by federal law. And what the waiver would do is say we're going to only cover one of those drugs. And not all drugs are created equal. Not all of them are equally effective, and they don't all cost the same. And keep in mind, all this starts with Governor Lee's statement that the goal is to save $1 billion, which, because half of savings would have to be shared with the federal government, translates into $2 billion. So if you're going after $2 billion in savings from this program, and part of the way you want to get there is through the formulary of what's covered for prescription drugs, your focus is going to be on cost, not necessarily efficacy.
Another question is around knowing the Trump administration's record around things like Medicaid. Do we have any confidence that the agency doing the review of the block grant, which is CMS, will not just be forced into or coerced into offering this block grant?
Well, that's a good question. President Trump and CMS have been very outspoken that they'd like to see states apply for block grants. No other state has actually done that. Alaska considered it, and their own state fiscal people said this would really be foolish. We don't want to go through with this. So, but we're the volunteer state, and we're the folks who put our heads on the chopping block. What is being requested is illegal. It is not legally permissible. But that does not mean that it will not be approved by CMS. And the fact that it is in my view, illegal does not mean that if it's challenged in court that it won't still survive. So we have to take very seriously the threat that this could be approved, or if not in its current form, then something that's negotiated that would be very harmful.
Great. So we'll just take our last question before we close out, which is, I like the way you're thinking, is are there any actions planned in Nashville or elsewhere to dramatize the opposition? I love that, and so right now, we're emphasizing the importance of getting as many comments submitted as possible, opposing this harmful proposal, and letting people, organize their communities in whatever way is most effective. So the December 5th call that we're going to have is how you can work within your community to generate as many comments as possible. If that works through some kind of event or some, organizing your church in a more public way, we encourage that. That's wonderful. And then one thing we're thinking about and looking toward as well is after the comment period, some sort of event or press thing that would dramatize all of the comments that we got, showing the strong opposition generated during the federal comment period with all of the comments. So right now, emphasizing making sure as many comments are submitted as possible, opposing this proposal, and then looking at how we emphasize that and show how many people came out against it right after. So.
Exciting question.
Yes, very exciting. So thank you guys so much for joining us 2 days before Thanksgiving. We're going to send out this information within the next day or so before the Thanksgiving holiday. And if you have any other questions, please feel free to reach out. We will be sending the slides, talking points, and the recording to you all, so you'll have that all for reference.
And can share it around the Thanksgiving table with your family and friends.
Yes, right. The pun is, you can discuss this turkey at your Thanksgiving table. So the turkey being the Medicaid block grant proposal. Anyway, thank you all, and have a great rest of your day.